Good morning, students. In the today's class, let us discuss about antineoplastic agent. Before starting this, let us know the definition of cancer, types of tumors, and the agents inducing cancer, and treatment, and about the diagnosis. Coming to definition of cancer. Cancer is a term used for disease in which the abnormal cells divides without control and are able to invade or spread to other tissues. Cancer cells can spread to other part of the body through the blood or lymph system. In short, we can say it as uncontrolled growth of abnormal cells. Coming to types of cancer. Carcinoma is a cancer that begins in the skin or in the tissues that lines or covers the internal organs. Again, it is subdivided into adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, transitional cell carcinoma. Coming to second definition, it is sarcomas. Cells that begins in the bone, blood vessel, muscles, fats, and other connective or the supportive tissues. Coming to next definition, it is leukemia. Cancer that starts in the blood, forming tissues such as bone marrow and causes large number of abnormal blood cells is called as leukemia. Coming to lymphoma or myeloma. Cancer that begins in the cells of the immune system. Coming to central nervous system cancer. Cancer that begins in the tissues of the brain and the spinal cord. Coming to tumor. Abnormal cells that forms lumps. Coming to types of tumors. It is benign tumor and malignant tumor. Benign tumors is non-cancerous. They can often be removed, and once if it is removed, it do not come back. And cells in the benign tumor do not spread to the other part of the body. Coming to malignant tumor, these are cancerous, and the cells in this tumor can spread nearby tissues and spread to other part of the body. This is called as metastasis. Coming to agents inducing cancer. The agents which induces cancer are 2-naphthalamine, long inhalation of asbestos, saffron, radioactive elements like radium, uranium, and adenovirus and the papavirus. Coming to treatment, surgery, chemotherapy, radiation, targeted therapy, and the laser therapy. Radiation therapy is considered to be the treatment of choice for many cancer. Radiation and chemotherapy are employed in the advanced Atkins disease. The development of antineoplastic agents is more difficult. Most antineoplastic drugs are highly toxic to the patient and must be administered with extreme caution. Chemotherapy is the initial treatment used against cancer. In normal tissues, the rate of new cell growth and the old cell death are kept in balance. But in cancer, this balance is disrupted. Coming to diagnosis of cancer, cancer can be diagnosed by biopsy, endoscopy, blood test, and by the genetic analysis. Coming to definition of antineoplastic agents. Antineoplastic agents are the drugs used for the treatment of cancer, malignancy, tumor, carcinoma, sarcoma, leukemia, and the neoplasms. Coming to classification of antineoplastic agents. First one is alkylating agents. Alkylating agents are again subdivided into 4 types, that is nitrogen mustard. Example is chlorambucil, mecloethamine, cyclophosphamide and melphalan. Coming to alkyl sulfonate, example is busulfane. Coming to nitrosoureas, it is carmazine and lomustine. And last subclassification is aziridines, it is thiotepa. Coming to second classification, it is antimetabolites. Again, antimetabolites are divided into 3 types. It is pyrimidines analog. Example is 5-fluorouracil, floxviridine and citarabine. Coming to second subtype, it is purine analogs. Examples are 6-mercaptopurine and thioguanine are the examples. Coming to folic acids analog, example is methotrexate and azathioprine. Third classification is antibiotics. Examples for antibiotics are doxorubicin and daunorubicin. Coming to plant products, first one is vincoalkaloids. Example is vincristine and vinblastine. Second one is epipodophylotoxins. Example is etoposide. Next classification is miscellaneous. Under this we are studying asparginase, cisplatin and hydroxyurea. And examples for hormones, it is testosterone. And the 7th classification is immunotherapy. Examples are interferons alpha 2A and interferons alpha 2P.